Welcome to the Soulful Surgeon Podcast with Dr. Lisa Hunsicker, a sanctuary for healthcare workers. In this space, we honor your stories, your struggles, and your triumphs. Here, you are more than your role. You are seen, heard, and celebrated. Join me as we explore conversations that nourish the heart, elevate the mind, and remind us why we chose the path of healing. This is your time. This is your place. This is the Soulful Surgeon Podcast. Hi, everyone, and welcome to the Soulful Surgeon Podcast. I'm your host, Dr. Lisa Hunsicker. This is the place where our healthcare workers come to be seen and heard. And today I want to talk a little bit about something that is so pervasive in medicine, but we really don't talk much about it outside of medicine. But if you talk to any healthcare worker, this really is one of the core issues that we struggle with. And that is, what are the expectations that people have of us? And should it be that every patient that we see in a crisis or in a fatal situation, is the expectation that every patient survives? And is the expectation that every surgery that we do just goes perfectly? And every diagnosis is made on time immediately, and there's no struggle, and every complication should be prevented. And I feel like that really is our daily struggle that we're dealing with, and that really everyone expects us as physicians and healthcare workers and advanced providers that we should be able to control all things. And really, that's just not even possible. So I want to talk about this whole idea of an undesired outcome does not automatically mean that something has gone wrong. And that might just be the natural evolution of what the patient's experience is. It also has to do with life, right? And this is the overall outcome that the biology of the situation has actually occurred. And so one of the things is, I feel like, dealing with cancer patients, I think there is an expectation that many people, they come in and they're so panicked and they just want to erase this diagnosis because it makes them just so uncomfortable, right? And the years of disease have led to disease. And now they want to fix that. And it's interesting because I know that many patients, the first thing that they want to know, at least in my world, is, when can we get to surgery? When can we get this out of me? Because they just need to move beyond that. But really, there is this whole responsibility of treating them and diagnosing them. But the outcomes, I feel that we're held to a standard that almost is impossible. And yes, we have incredible striving and we want things to be better. We're always learning. And we have the privilege of caring for people. And I don't think people understand how much we care about our patients. But I think that there is another, when I see a patient, I come in with two suitcases, right? I come in with my knowledge suitcase, and so we can sit down, we can have a conversation, and we can really understand the situation and make a plan together. But also, I have this other suitcase that I carry with me, which is, what am I going to miss? What is the complication that can occur? How do I prevent every single complication that has absolutely nothing to do with me? And so I want to think about performing, and not really performing as an acting, but really taking the best care of my patients, but also taking care of me as well. And I think that physicians always wonder, am I making the right decision? And we don't have all the variables. And I think this is where, when we talked about perfection before, perfection demands that you know all of the variables, and that's just not even possible. So when we're caring for patients, it's like, I'm sorry, Mrs. Jones, you have to show up with, all the variables so I know how to make this go. And right, Mrs. Jones has no idea what the variables are. And we're trying to do the best that we can, both the patient and the physicians. But really, I think people don't realize that, patients may experience their worst day once, but physicians will relive that day over and over and over for the rest of their careers. But also, in addition to that, they're experiencing everyone's worst day every single day. And I might be in one room and I step out, I pick up the chart and I go to the next room to where that patient is experiencing their worst day. And this is over and over and over for all these experiences that we as healthcare providers are actually having to experience regularly. I think we have to really begin to talk about the difference between accountability and an impossible standard that there's no way for us to really ever meet. And I want to make a big distinction because, accountability is necessary. And we build this into medicine. It should be transparent. Negligence should have consequences. But negligence is not necessarily mistakes because mistakes need to be acknowledged. And the system should improve, and we should constantly be working. And that's why we have quality improvement, right? Quality assurance programs so that we can continue to grow. However, despite this, patients deserve honesty and they deserve transparency. And I can think of cases where something has happened with a patient and we have a complication that's going on, and it may have to do with something on our end. And I've had a time where we were going in to do a cancer surgery for a gal, and the implants for her breast reconstruction, they just got sent home. They were all ordered. Everything was ready. She's in the pre-op bay and she's ready to go. And we have no implants. Literally, we're like 1 minute from pushing back, and the staff have been scrambling all morning, and they notified me, which now I have to notify the patient. And obviously, this is a horrible patient experience. And in explaining this to the patient, she was very disappointed. As you can imagine, you're preparing for a cancer curing type procedure, and by the way, sorry about that. We're not going to do that today. We're missing the key part of your procedure. So that doesn't inspire a lot of trust. But I think sitting down and what I did was I just sat down and explained to the patient exactly what happened, how disappointed I was for them, and how everyone felt terrible, and that we were going to do our best to get right back on the schedule. And so now she understands that. It still doesn't make it any better. But I think that omnipotence and accountability, right? They're not the same. I think that we should be accountable for what we do, but I can't control every single thing. I can't control how a patient's cancer behaves. I can't control someone being shot or in a car accident and the natural biology of those injuries. I can't control every medication reaction that someone has. I can't control every surgical complication, and I certainly can't control every patient event. And I think that that's something that we struggle with because the expectation is that we're going to receive patients in a way that we just take them on and everything in their journey will be flawless. And that's really not possible. And I think that there is a cultural expectation, but I think also the legal community has really put us in a very difficult position because what ends up happening is every bad outcome, it just gets treated as if someone failed. And what this message is that medicine should be perfect, and it's frankly not. And it's not even possible. And so the problem is that you have people who now are running in fear. And so, like I said, when I go in to see every patient, I go in with my knowledge bag, but I also go in with my defensive bag of every experience, no matter how small, that I'm going in with the idea of the fear of a lawsuit. And, is someone going to damage my reputation? Are they going to go online? And patients manipulate us all the time, and they know that we can't respond, right? Because it's HIPAA. And so I can't even acknowledge, If you have a terrible outcome and you want to put it all over the internet and say what a terrible physician you had, that physician can't even give any context for the rest of the people to kind of defend themselves and actually provide appropriate judgment. It's just a very difficult situation because of HIPAA. And this allows public criticism without context. And, there's people that can get blamed for things that are unavoidable no matter what they do. And so, how this translates is excessive testing. And so, we in medicine call it CYA, right? It's cover your, what. But we're doing it not because we're trying to get more information. We're doing it in anticipation of a lawsuit and sitting in front of a judge and jury and trying to explain to people who have no medical experience, possibly, so that they can understand what was done. But really, actually, what we would say on the stand is like, well, actually, that test was not even necessary. I was doing it for the attorney representing this person because I knew that on the court case that was going to be asked. It's actually not relevant, but it's being presented in these cases. And so you get more and more documentation. It takes forever, when we do all the charting, like with surgeries. I prepare, I do all the surgeries, and then I have to log in the computer and I have to put all the information into the computer for the electronic record, and then I dictate the chart. So there's so much documentation that goes. And while documentation is incredibly important because I need that, every person needs that because we can't remember all the patients all the time and all the nuances. So we need that information. But now what we end up doing is we start to avoid high-risk patients or high-risk procedures. And we're just stepping away and stepping away from those people. And actually, it ends up in this movement with healthcare workers leaving medicine. And so when I spend more time trying to protect myself from the possibility of being blamed and sued than I actually spend in time with my patients, I mean, everybody loses in that scenario. So I feel like we have to come up with something different. And I think patients need to really understand, really, there's so much more going on in the room than what they're experiencing. And it's really important for patients to understand that they are not the enemy in this. Patients are they're the whole reason that we've been here in medicine, right? We came to medicine for them. But what they also need to understand is that, medicine isn't a guarantee, and every good doctor can have a bad outcome. And a poor outcome doesn't always mean, poor care. And, if you've been shot in the chest and you come in and you arrive dead and you stay dead, right? That's not necessarily a poor outcome based on poor care necessarily. That might just be the natural biology and the evolution of that injury that really there's no recoverability. And I think we have to really start looking at this and really separate, accountability from controlling all factors of the universe, right? And so I think we need to start treating healthcare workers with a little bit of humanity and treat us like human beings. And I think we have to do that and give grace to one another because I don't think the public is necessarily doing that for us, but I do feel like we have to start really in our own community and really having these conversations, really talking about it and giving each other grace. But I do feel like we have to have conversations like this with our patients so that they understand why we practice the way that we do. And I think that, the more that we talk to them, the more they understand where we're coming from. And, with insurance and especially in primary care, I don't even know how my colleagues do that. You get 5 minutes and you've got to connect to the patient, get the whole story, and figure all this out. And so part of this is the system. And I think that as patients, they should really try and understand they've only got 5 minutes. and maybe make some different choices. And we as physicians maybe need to start changing the conversation, not only with the patients, but with ourselves, to really give our own selves a little bit of room to breathe. So I think that we really need to work on a cultural shift within our own community and how it displays out to patients as well, because I think we need to really let people know that we're about accountability, but not about perfection. And really, perfection is excellence without the ability to pivot or breathe. And what the patients need for us to do is be able to breathe and to pivot, because they don't roll in with all the variables. They don't have a little piece of paper that says, here are all the things wrong with me. These are all the medications that work perfectly with me. And this is the time frame that I'm going to feel better. So I feel like until that happens, which is never, then we have to begin to really shift our expectations about what outcomes need to be. I think that we need to have transparency without blame. And I think we need to be able to learn and not shame. And I think one of the biggest things at least in surgical training, as well as even current practice, morbidity and mortality conference is part of it. And in some scenarios, it is one of the most toxic experiences, because really you stand up and explain whatever the bad outcome was, and then your colleagues get to take pot shots at you when they're playing Monday morning quarterback. And we really need to learn without shaming people. And the whole idea is, if you learn, you get better. And if you make it this fear-based situation, then, like we talked about before, right, your brain is hijacked, your executive function is gone, and you're not going to be able to do what you need to do. And so I think we need to talk about that. We need to have compassion for patients, but we also need to have compassion for ourselves. And we're not striving for perfection. We're striving for mastery. We're really striving for excellence. But we also need to have humility. We need to have honesty with our own selves, but honesty with patients. But I think we need to get to a place where we have courage and compassion to be able to take care of the patients when outcomes are breaking our hearts every single time. So the next time that you see your patients, try and just see if you can set that extra suitcase of the outcomes in the litigation, really begin to have that conversation when you walk in the room with them, so that patients can have a good understanding of what their outcomes are. And then maybe you can also have that a little softer version for yourself as well. And the legal system, we're just going to have to navigate it. But I think the more that we spend time and energy and really put our hearts into a relationship with our patients, I think the less contact with the legal system we're going to encounter. It's not going to be zero, never, but this will improve it. So think about this, and I really invite you to put comments down and let me know, so what are some of the difficult outcomes that you've had, that you've been held really to a very unattainable standard. And let's talk a little bit more about that. Thank you, everyone. If this podcast has really resonated with you, I invite you to share it. I also invite you to share it with your colleagues, because we really have to start talking about this. And you can find us here at Soulful Surgeon. We'll see you next time. Thank you for joining me on the Soulful Surgeon Podcast. I hope today's conversation offered you reflection, encouragement, and a reminder that you are not alone on this journey. If this episode spoke to your heart, please share it with someone who might need it as well. And don't forget to subscribe so you never miss a moment of connecting with healthcare workers all over. You can find us on the web at soulfulsurgeon.com. You can find us on Instagram at Soulful Surgeon. And you can find us on LinkedIn at Lisa Hunsicker, MD. Until next time, take care of yourself the way you care for others. And remember, your story matters here.